Ms. Maskey, but before I do, I just want to clear one thing up. Professor Bridges, you said several times, you've used a phrase, I want to make sure I understand what you mean by it. You've referred to people with a capacity for pregnancy. Would that be women?
Many women, cis women, have the capacity for pregnancy. Many cis women do not have the capacity for pregnancy. There are also trans men who are capable of pregnancy, as well as non-binary people who are capable of pregnancy.
So this isn't really a women's rights issue.
We can recognize that this impacts women while also recognizing that it impacts other groups. Those things are not mutually exclusive, Senator Hawley.
Oh, so your view is that the core of this right then is about what?
So I want to recognize that your line of questioning is transphobic, and it opens up trans people to violence by not recognizing that.
Wow.
So what's on tap for today? Well, folks, you got a little bit of right now. Those were the fireworks that were erupting in the Senate chambers between Professor Khiara Bridges and Senator Josh Hawley. This was unbelievable, folks. The disdain, the contempt that this witness had for the Senate, and especially for Josh Hawley, and the way that she answered the questions, you've got to see as the fireworks erupt, all right, especially from her side. So we're going to get to all that, but before we do so, you're watching the Dr. Nasir Shaikh Show. I'm your guest host. My name is Dr. Shaikh, and if you haven't already done so, subscribe to our channel, hit that notification button, like and share us. And what I want to do is give you some of the comments, folks, just some of the things that I was thinking that when this was going on, some of the body language and all those things. So we're going to get to that. We're going to do that right now.
Ms. Maskey, but before I do, I just want to clear one thing up. Professor Bridges, you said several times, you've used a phrase, I want to make sure I understand what you mean by it. You've referred to people with a capacity for pregnancy. Would that be women?
Many women, cis women, have the capacity for pregnancy. Many cis women do not have the capacity for pregnancy. There are also trans men who are capable of pregnancy, as well as non-binary people who are capable of pregnancy.
So this isn't really a women's rights issue.
We can recognize that this impacts women while also recognizing that it impacts other groups. Those things are not mutually exclusive, Senator Hawley.
Oh,
If you see right here, you can see her eyes. I mean, she is, her eyes are laser beam focused, okay, on Senator Hawley. She does not like this line of questioning. She doesn't like his take. She doesn't like anything about this. You can see she's, like holding onto her chair, trying to make sure that she doesn't, reach across the table or do something, okay? I mean, she is, you can just tell, she really does not like Senator Hawley at all. And she wants to make sure that she gets her point across, regardless of how it sort of, comes across. And she's going to go after him with no respect, none whatsoever. Let's continue to watch.
so your view is that the core of this right then is about what?
So I want to recognize that your line of questioning is transphobic, and it opens up trans people to violence by not recognizing.
And there you go, folks. If you can't play the R card, the racist card, you can't play the B card, the bigot card anymore, because they've been using it so often. So they will have to reach into their deck, open up a brand new deck, and pull out a brand new card. And what's that new card? It's the T card, folks. Transphobic, transphobia, right? Uh-oh, you hit me with the transphobic word. Oh, I got to be quiet now. I got to zip my lip, take it, and throw away the key and never open up my mouth again. That's what they're using here. But Josh Hawley, cool as a cucumber, doesn't faze him one bit. Let's continue.
Wow, you're saying that I'm opening up people to violence by asking whether or not women are the folks who can have pregnancies?
So I want to note that 1 out of 5 transgender persons have attempted suicide. So I think it's important.
Because of my line of questioning?
Because,
so we can't talk about it?
Because denying that trans people exist.
See, that's what happens. You can't talk about it. You can't even bring the question up because they're going to just try to shut you down immediately. Whether it's the mainstream media, the people in academia, the hypocrites in Hollywood, the alphabet networks, whoever it is, Google or, at one time Twitter, any of those media platforms. And then the thing is, you can't bring it up. You can't even think about bringing it up. Can't even think it. As soon as you think, oh, wait, you were thinking it. I know what you were going to say. You were going to say something. You got to stop it. no diversity of opinion, no diversity of thought. And as soon as they do it, try to, basically stop the conversation immediately by throwing out the transphobia word.
Exist and pretending not to know that they exist.
I'm
is
denying that trans
dangerous.
people exist by asking you if you're
Are
talking
you?
about women
Are you?
having pregnancy.
I mean, what was it? Are you? Are you? Are you? What is she, roofing and woofing over there? I mean, what is she, a little puppy? Are you? Are you? Are you? Scooby-Dooby-Doo. Are you?
Do you believe that men can get pregnant?
No, I don't think women can get
So you are
pregnant.
denying that trans people exist?
And that leads to violence? Is this how you run your classroom? Are students allowed to question you, or are they
Absolutely.
also treated?
Oh, he hit a zinger right back at her, right? He's just there, right? He's got his, pen in his hand, pencil in his hand. And he said, is this how you run your classroom, ma'am?
Like this, where
No,
they're
they're
told
allowed
that they're
to question.
opening up people to violence.
We have a good
by
time in my
questioning.
class. You should join.
Oh, I bet.
You might learn a lot.
Wow, I would learn a lot. I've learned a lot
I
just in this
know,
exchange.
absolutely.
Extraordinary.
Yep.
Ms. Matsky, let me ask you something. So,
She had some spunk, I have to tell you. She wasn't phased. She didn't give a rip, okay, that what she was there in the Senate chambers. She just wanted to get her point across. Okay, listen, it's a free country. She's got freedom of speech, which she doesn't want to give us, all right? But it just goes to show you to what level these people will go to, folks. To what level they will just go to the depths of excrement to do whatever they can so they can maintain power and control over everybody else.
you provide health care to women free of charge, right? Is that right?
Absolutely.
You've done this for many years.
Yep.
You have licensed medical professionals at your pregnancy care centers. Is that right?
That is correct.
And what are some of the resources that you provide for women who come to you in a time of need?
So-
Just give us you talked about it in your written testimony, but just give us a sense of it.
So we have 3 OBGYN doctors, 5 registered nurses, nurse practitioners, physician assistants, phlebotomists, medical assistants, and we provide prenatal care, OBGYN care. We provide pregnancy tests, ultrasounds, well woman visits, breast exams. We provide a wide range of medical services. Yes.
So,
And I just want to say, as a physician, I know some colleagues that go to these alternative pregnancy centers. There's like over 3,000 of them, folks, all around the country. You just have to Google them, provided that Google doesn't, censor it or, put the search results way down in, page number, 10,000 or whatever. But that's what the libs and the Democrats and progressives, they try to do. They try to stifle, they try to, crush anything in terms of, finding out where these are. There's more of these alternative pregnancy centers than there are Planned Parenthood centers.
what do you think about the DC politicians now saying that your clinic and the other 3,000 pregnancy care centers around this country are fake medical clinics? For instance, Senator Warren has said it's now more important than ever to crack down on so-called crisis pregnancy centers that mislead and deceive patients. Senator Menendez, crisis pregnancy centers jeopardize women's health and well-being, all while elevating unproven theories about birth control. Senator Warner wrote to Google asking them to censor search results for care centers like yours, saying, directing women to fake clinics that traffic in misinformation is dangerous to women's health and undermines the integrity of Google's search results. Do you run a fake clinic? I mean, is that what's happening here? You don't provide actual medical care to actual women?
We absolutely do not run a fake clinic, and we have a full medical staff. Like I said, many of our medical professionals have experienced abortion for themselves, including our OBGYN doctor who used to perform abortions. So our entire medical staff is there for women, whether they choose abortion and walk out the door or whether they choose life for their baby, and we support them for years after that.
Do you think that
What could be more democratic than that, folks? Even after a woman goes to these alternative pregnancy centers, even if after that she wants to have an abortion, they will, I mean, it's her body, her choice. But she's making a choice. The leftists, the progressives, Senator Warren and these other people, the abortion, Planned Parenthood Incorporated, these people, they don't even want that option on the table that there's an alternative to abortion. That's it. Abortion up until the time of birth, even after birth, that's perfectly fine. But anything else, talking anybody else out of that, any other choices, they're not for pro-choice. They're for one choice and one choice only. We know that.
There ought to be an ideological test to be able to get medical care in this country. I mean, should we say to women, well, you have to agree with the DC Democrats' ideology, otherwise you can't go get medical care. Or maybe for you and the physicians who work at your pregnancy care center or the thousands of others across the country, should we impose an ideological test on them and say that, well, you have to agree with the DC Democrats' position on abortion or you can't provide medical care to women? Should we do that in this country?
Absolutely not.
I just want to ask in my few remaining seconds here, Ms. Hawley, the Dobbs decision, as I understand it, I've read it now a number of times, it gives to voters the decision as to what laws should be pertaining to life and pertaining to abortion in all 50 states and other jurisdictions around the country. I'm just curious, do you know what percentage of voters in this country support the DC Democrats' position that they want to impose on the entire country, a one-size-fits-all rule they want to impose from the top down? Do you know what percentage of voters support their position, which is also, by the way, the same position taken by North Korea and China, other notable violators of human rights? Do you know what percentage it is?
I know that nearly 90% of Americans oppose abortion in the third trimester. The number that would support abortion up to the moment of birth has to be minuscule. It's a horrific policy.
Yeah, I mean, based on the most recent Harvard poll that was just released just a few days ago, it's less than 10% of voters say that they would support abortion into the final month of pregnancy, and yet that is the law that the DC politicians want to impose on every voter in America, to take this away from the people, take it away from my state, take it away from all the other states and the voters in the states, but impose this law uniformly that is not supported by 90% of the American people. Talk about anti-democratic. At the same time, they want to shut down 3,000 pregnancy care centers all around this country. That's radical. Thank you for being here.
Senator Padilla.
Well, that's it for today, folks. Hope you enjoyed that. Hope you enjoyed the comments. You know what? As I said before, you've been watching the Dr. Nasir Shaikh Show. I was your guest host. My name is Dr. Shaikh. Come on back to the show. Subscribe to the channel. Hit that like button. Share it. Notification bell. You know what to do. And I'll leave with my final thought, as I always do, folks. And that is, when you're right, you're right. And we always are. And when you're left, they're always wrong. We'll see you again next time, folks. Take care and stay safe.